Video about the pericardium. You can see this is the heart and this is the covering of the heart, that is the pericardium. You can see the outer layer, that is the fibrous pericardium. If I turn back the outer layer, you can see the inner glistening layer, that is your serous pericardium. Serous pericardium will be divided into two parts. That is, one is the parietal pericardium, which is adherent to the fibrous pericardium. Another one is the serous visceral pericardium, which is adherent to the heart surface. That's why it is called as visceral pericardium. You can see the glistening white color. And if I try to remove, it won't be coming. It is tightly adherent with that. Between these two spaces, we have the pericardial cavity. The pericardial cavity contains a fluid called the pericardial fluid. And then you can see the right atrium here, and the vein drains into the right. Draining into the right atrium is superior vena cava. So if I reflect the pericardium nicely here, you can see the veins superior vena cava. This one is coming from the, can you see, if I reflect, this one is coming from the ventricle. So this is pulmonary trunk coming from the right ventricle, that is the arch of aorta coming from the left ventricle. So we have two sinuses inside the pericardium. These are all called pericardial sinuses, where you can see the pericardial sinuses. Here you can see that between the visceral layers, you can see the transverse sinus. Now I put my finger beneath the pulmonary artery and the arch of aorta. You can see my finger coming outside that. So between this sinus is called the transverse sinus. Behind your atrial chamber, left atrial chamber is down. So now I put my finger here and see the anterior boundary is pulmonary trunk and the ascending aorta, and then posterior boundary is superior vena cava, and that side you will be having the four pulmonary veins. Four pulmonary veins are situated that side. I'll come to this side and I'll show you the four pulmonary veins. You can see the four pulmonary veins present here. So this is about the transverse sinus. So again I'll put my finger, yes. So you can see the four pulmonary veins clearly inside that. That is the transverse sinus, and we'll see the oblique sinus. How to this is present in the visceral layer and serous layer, between the two serous layer. Here I will lift it up and I will put my finger inside and then show you the oblique sinus. This area is the oblique sinus. The oblique sinus, my fingers are present in the base of the heart. Base of the heart is formed by the left atrium. So this is your right atrium, this is your right ventricle, this is your left ventricle, and the left atrium is present posteriorly, that is called as base. So in that only you can see the pulmonary veins. So can you see the pulmonary veins? If I stretch, you can see the pulmonary veins are going here. There are four pulmonary veins coming from the atria. So if I put my finger inside, I am not able to go beyond that because of the pulmonary veins are blocking that. So superiorly pulmonary veins, and anteriorly my fingers are here, so it is lying in the atrium, left atrium, and posteriorly nicely the parietal pericardium I could see. So posteriorly, inferiorly it is free because it is opened, it is free. These are the boundaries about the oblique sinus, and the boundaries of the transverse sinus are superiorly these two major trunks, pulmonary trunk and the ascending aorta, and inferiorly you have the superior vena cava that side and the pulmonary veins this side, and inferiorly, so anteriorly, posteriorly. Anteriorly major vessels, posteriorly superior vena cava and the pulmonary veins, and inferiorly which atrium is here? Down, left atrium is here. So these are all about the parietal pericardium. Parietal pericardium, below it is attached with the diaphragm with the pericardiophrenic ligaments, and here superiorly it goes and merges with the great vessel walls. Okay, so I am not able to retract this. Okay, and the blood supplies, you can see nicely the pericardiophrenic vessels are here. Can you see this? These are called pericardiophrenic vessels. Pericardiophrenic vessels supply the pericardium, and the pericardium is getting its supply from nearby structures also. So this heart is present in the middle mediastinum. Pericardium, you have the parietal pericardium and the visceral pericardium. Parietal pericardium, it gets its supply from the, from the phrenic nerve, and it gets its nerve supply from this nerve. It is sensitive to pain, and the visceral pericardium, as expected, as usual, it is getting its supply from the autonomic nervous system, so it is not sensitive to pain. So this is sensitive to pain, parietal, and it is not sensitive to pain. Thank you.